I am with Valerie Taylor from the Women's College Hospital and also a professor at University of Toronto. Valerie, you are a psychiatrist,
yeah.
So you know about the psychology.
Yeah.
And we know that psychological aspects are very important in the behavior changes in respect of weight management. What we know less is about mental health link with these psychological aspect. We know, for example, like some drugs are involved. So many aspects are involved into the etiology, but also in the management of weight control. Can you talk to us about it?
Absolutely. And so a number of psychiatric illnesses, like depression, for example, which is very prevalent, it affects 25% of the population. Some of the symptoms of this illness impact your energy level, your appetite, sleep patterns. So simply having this diagnosis is going to increase your risk of having weight problems. We also know that illnesses like attention deficit disorder, for example, increase rates of weight problems. If someone has undiagnosed attention deficit disorder, it's virtually impossible for them to adhere to a diet or be able to plan meals. And so all of those things can impact their ability to lose weight. And as you mentioned, a lot of the psychiatric treatments that are necessary in order to get these illnesses under control also, unfortunately, have as side effects weight gain. And so on one hand, the illnesses untreated can impact weight regulation. On the other hand, the treatments we have of these illnesses also impact weight. And so it's really important that both patients who are trying to get their weight under control and the physicians that are treating them understand that there's a link and that you try to manage as best you can any side effects that are related to these kinds of drugs. And make sure you choose the drug that's best for the particular individual. Not all of them carry the same risk, and it's important to tailor treatments appropriately. And we also know that there's a lot of biological variables. With depression, for example, there's an increase in inflammation and there's an increase in cortisol. When people gain weight, we have the same patterns. You get an increase in cortisol and you get an increase in inflammatory markers. Cortisol is associated with weight gain. And so if you have fat tissue producing cortisol, and cortisol then makes depressive symptoms worse, which as a consequence require people to have antidepressant treatment, which then makes weight worse, which then increases cortisol production, you get into a vicious cycle. And so from very psychological reasons to very behavioral ones, having a psychiatric diagnosis can have a significant impact on both the success of a weight loss intervention and just having weight problems in general. And so it's really important that when treating individuals one-on-one or when designing population-based programs to try to make a change in weight patterns, that we consider these variables, because they make it very, very difficult for anyone to achieve success with getting their weight under control. So symptom of depression not only has a complication, but even more has the etiological aspect of obesity, right? Absolutely. And so depression, when people are depressed, they can start to get into behavioral patterns where they don't want to exercise and they don't want to engage in behaviors that are going to help them be healthy. As a consequence, as you put more weight on, you're going to feel worse. That causes your depressive symptoms to be exacerbated. And so again, we get into a vicious cycle where if you're depressed, you're going to gain weight because you can't engage in any of the behaviors that would improve your lifestyle. As that increases, so too do symptoms of depression, because people become very frustrated when they can't lose weight or when their weight loss attempts aren't succeeding. And then that's exacerbated when we look at the fact that some of the treatments that make depression better can in the short term start to increase weight. And so you really have to make sure that patients understand this and that physicians understand this, and we do the best we can to minimize it, or it makes it very, very difficult for individuals to cope with these kinds of behaviors.
In order to better understand the importance of mental health into the etiological aspect of obesity, could you tell us about the proportion or statistics of people obese in the general population compared to those who have some mental issues?
Absolutely. And so we talk about an obesity epidemic that's gripping the country. We know that unfortunately, rates of overweight and obesity are increasing on a population level. If we look at individuals with mental illness, these rates are even higher. And so you're more likely, if you have a diagnosis of a psychiatric illness like depression or bipolar disorder, schizophrenia, even anxiety, you're much more likely to have higher rates of overweight or obesity. And the converse also happens. If you have significant weight problems, especially if these weight problems started when you were younger, your chances of developing a mental illness as you grow older are much higher than would be the chances, for example, of somebody who didn't have weight problems. And so that certainly doesn't mean that everyone with weight problems has a psychiatric illness, and it doesn't mean that everyone with a psychiatric illness is going to develop weight problems, but we know that the two go together much more often than one would expect, and unfortunately both conditions make treatment of the other much more challenging.
So a research subject that is growing certainly these days?
Absolutely. It's unfortunate that this is an issue for a lot of individuals, but I think the exciting thing is that people from all medical disciplines, people in basic science, people doing epidemiological research, everybody is starting to understand some of these links and are starting to focus on the ways in which they impact the etiology of obesity and the way in which we can design interventions that start to take some of these things into consideration. So I hope it's actually going to help us make a difference in terms of our understanding both of mental illness and of obesity.
Thank you very much. Yeah. So that was Valerie Taylor and Paul Boisvert from Duchesne at the Obesity Bootcamp 2011.
Thank you.